Welcome to the Lowdown on Ghanaweb TV. This is your most informative socio-political program you can find online. We give you all the facts and updates on issues that matter to you. My name is Ismail Akwei. In this edition, we are going to discuss a very important subject matter that affects the cross-section of Ghanaians. That's sickle cell disease. What is a sickle cell disease? How is it treated? What are all the issues surrounding the sickle cell disease in Ghana? We have some sickle cell disease advocates in our studio. They are going to tell us more about the disease and also how best we could create a very conducive environment for those who are affected by it in the country. We'll be right back and we'll introduce them and discuss more about this topic after this break. Welcome back from the break. This is the Lowdown on Ghanaweb TV. Our guests, as we said earlier, for this important discussion are Dr. Enam Sefakor Bankas. She's the Managing Director of Sickle Life, and also Esi Duker-McMartey. She's the founder of Sickle Cell Awareness Initiative. Welcome, ladies.
Thank you.
I like your shirts, quite bright red. It matches with our new sets.
It does.
Indeed, this is not a set we use, but today we're trying to change things a bit.
It looks good.
Yes. So, Dr. Enam Sefakor Bankas, yes. I will start with you. We know sickle cell is a very important subject in Ghana, and a lot of people have a lot of misconceptions about sickle cell. But if you can tell us, what's the population of people who are affected by the sickle cell disease in Ghana, if you have that figure?
Okay, thank you very much. So, unfortunately, we don't do a lot of research about this condition in Ghana and even globally. However, we know that about 500,000 people live with sickle cell disease in Ghana, and data suggests that 2% of newborns born in this country have sickle cell disease. So that amounts to 15,000 babies born with sickle cell disease every year in this country. And to make it more real for us, we need to understand that every 1 in 3 people in this country have the sickle cell trait. What that means is that you have the capacity or the ability to pass on the traits to your children. So it's very important that we talk about sickle cell disease, because with this information, we know that the prevalence is high, and so there's a large number of people who have this condition, and there's also a large probability of passing on this condition to our children. That's why we need to talk about it.
As a Managing Director of Sickle Life, I know you reach out to people who are living with sickle cell disease. How many do you have in your circle?
So currently, we have a support group that has over 250 people actively on that page. And that's just because of the limitations of WhatsApp.
Yes.
But then, other than that, we also have a lot of people in the communities that we go to, that we engage with. And then we have people who are not able to utilize WhatsApp platforms, who we are also engaging with through our support group members in the communities. But just on WhatsApp, we have 250 people, and then we have others on other social media platforms.
Then let me come to Nanesi. You are the founder of Sickle Cell Awareness Initiative. Do you also have a support group?
Yes, we do.
How many are you?
I would say our reach is in the thousands, just because we don't take advantage of just traditional channels, digital channels. We do a lot of direct targeting, and a lot of our campaigns and awareness outreaches that we get involved in, we make sure that they reach the masses. And so, yes, we do have smaller cells of support groups, but we are not as, I wouldn't say, boots on the ground as well networked as Sickle Life, which is why we do a lot of work together. But combined, our NGOs reach thousands of people every day.
So there's one statement, it's very unpopular, that people say that sickle cell is a death sentence. Is this something that you would agree to or disagree to?
Absolutely not. Vehemently disagree to, just because I think that in itself is symptomatic of the national narrative around sickle cell disease and why we have morbidity rates that are so high in the country vis-a-vis in developed countries that also have a sickle cell prevalence, but they are living well into adulthood. And so it's absolutely not a death sentence, but a lot of these deaths associated with sickle cell are preventable. And so it's conversation and language that we should move away from. The sooner the better.
Who is the oldest person you know living with sickle cell right now, and what's the age? Maybe that could give us an idea.
Mama Lucy, yes, she's a part of our group. She is 92 this year.
Oh.
Yes.
And she's living with sickle cell.
Living strong. Living strong.
That's quite interesting.
Yes.
What about your group? Do you have an oldest person? Same. Mama
Yes.
Lucy. We would want to meet her one day and have a discussion.
Absolutely,
Yes.
we can arrange it.
Now let's go into the health part of it. How does one get sickle cell? I know there are some misconceptions that it's either a curse or the other popular one is through the foods people or women eat when they are pregnant. I've heard that as well.
Okay.
How does one get sickle cell?
Okay, so sickle cell is a genetic disorder. What that means is that it's something that is intrinsic to you. It's something that you are born with. It's not acquired from what your mother eats or being associated with someone who has the condition. So the only way you can obtain it is if your parents happen to have the trait for the condition. When I say the trait, it means that they have the mutation or the genetic change. And so maybe as we talk, we'll explain this further.
Yes.
But then a person has sickle cell disease when they have two of this change gene, right? And so what is called the normal variant, which we don't like to use that kind of language, is A. You hear people saying I'm AA, I'm AS. Yeah. Yes. So the unmutated form is the hemoglobin A. And then the mutated or changed form is the hemoglobin S. And then other mutated ones. So there are other types like S, like C, like E, like O. If I discover one today, I'll call it Enam or Bankas. Right. So when you inherit one from your mother and one from your dad, that's what forms your hemoglobin genotype. So your parents may be, let's say, AS and then AS, and then when they meet and then you have one from them, each of them, then whatever you have, if there are two of these non-A forms, then you have sickle cell disease. Okay. So a person has sickle cell disease when they have a hemoglobin S and any other mutated form, right? So hemoglobin SS, hemoglobin SC, hemoglobin S beta thalassemia, all of those are sickle cell disease.
Okay. And with the differences you are mentioning, with the SS, SC, and the others, do they vary in terms of its severity, or they are all the same? Okay,
so the differences are actually because of the exact type of change or mutation that happens and where the position is. And there are also differences in the clinical expression of the disease. So hemoglobin SS is the most severe and most common form. And then the others, like SC, S beta thalassemia, are milder forms.
Okay. And which one shouldn't you ever have? SS? Is that it?
And we wouldn't say don't ever have A. But then, yes, the SS is more clinically severe. However, there are also certain clinical presentations that are more common in other types. For example, a person who has hemoglobin SC is more predisposed to getting something we call retinopathy. Retinopathy is a clinical effect of sickle cell on the eye that can lead to blindness. Okay. And that is something that is not common in SS. And it happens because people with SC have a higher blood level or hemoglobin level, right? So even though when you are SS, your blood level is always lower because you are SS, when you are SC, your blood level is higher, but then it puts you at risk of retinopathy. And then there's something else also called avascular necrosis. That's also more common in the Esi genotype, right? So even though we may say one is milder than the other, there are also certain things that are more common in what we deem to be milder. So they all have different challenges that they deal with.
So this is quite an important question. Would you advise anyone who has been diagnosed with an AS to marry someone who is also AS?
Thanks. So it's not a mandate to decide for people who to marry. Ours is just to educate people, give them all the information, and then we leave them to make that informed decision. And we know that elsewhere people are regulating who can marry who and what should be done. But then for us, the important thing is that we tell people not to wait until it's time to get married and then you go and do the test, because at that point you're already biased in your decision making. So even when we give the information and people are not willing to listen to us and to make any informed decision. However, what we do is that we give you the all the information about your risk or chances of having a child with sickle cell disease. So in this example, for an AS parent, we know that the chance of having a child who is AA is 1 in 4. And then the chance of having a child who is SS is also 1 in 4. And then the chance of having a child who is AS is 2 in 4, right? But this is with each pregnancy, right? So it's not like when you have 4 children, then it's 1 AA, 1 1 SS, and then 2 AS. That's not it. Every time you get pregnant, it resets. So we just put this information for you, and then you have to decide on your own. But then we also know that there's advancements in medical knowledge. And so when we are giving the information, we also have to let them know that there are various levels of prevention. So there's primary prevention, where you want to avoid the condition altogether by not even trying, right? And so in this case, there are some people who really, they may have those genotypes and they don't want to have kids at all, right? So they may get married and not have children at all. There are some who will get married and also opt for IVF with genetic selection. It's a very valid option. There are some who will go in for adoption. It's an option that is available. There are some who will go in, leave it to genetics, chance, whatever will happen, have that child with sickle cell and opt for all the medications that we've mentioned, the hydroxyurea, the crizanlizumabs, every medicine that is now available, right? And there are some who can even afford this bone marrow transplant or will go in for gene therapy. All these things are valid options, and our place is just to put this to the people, and then you do that assessment on your own. That am I in a position to afford a bone marrow transplant? Can I assess gene therapy? Do I have the social support to care for a child with sickle cell disease? You know, so it's a person by person decision, but then at the end of it, you just need to be able to make that informed decision. So that's all we do.
We've been schooled by Dr. Enam Sefakor, Bankas, and you are a medical doctor.
I am.
Yes, and you've given us all the very important terminology, which is more medical, and we could read more about it and we'll speak more about all these traits of sickle cell disease. We'll be right back after this break for more. Stay with us. Welcome back from the break. This is the Lowdown. My name is Ismail Akwei, and we have our guests here. That's Dr. Bankas and also Esi, and we are talking about sickle cell disease. So you were giving us a lot of terminologies about how the hemoglobin and also the whole blood cells come together to create the disease, and it's something that happens genetically as well. Now, what about the effects after a child is born and the child has been diagnosed? Is it diagnosed? Yes.
Diagnosed.
The child has been diagnosed with sickle cell, maybe SS, maybe SC. What's the first thing that's done at the hospital?
Well, it depends in every circumstance. It's one, I think a lot of it has to do with where you are born. And so the interventions that can happen, there are some countries and in some parts of the world, everyone is screened when they are born.
Okay.
So you're able to detect sickle cell disease at birth. And where there's advancement in medicine to that level, it means that treatment and interventions can begin straight away. You go on certain medications that aid with the management straight away. You go on certain medications that help to prevent infection straight away up until you're at the age of 5. And so monitoring is easier. In Ghana, it's a different situation. Over the last 2 decades, we've made a lot of advancements with regards to newborn screening and what have you. But I, for example, didn't get diagnosed with hemoglobin SS until I was 8 years old.
Oh.
And so I
In
didn't.
Ghana?
In Ghana, yes. I found out in Ghana. I was unwell, and my parents took me to the hospital, and the doctor said, you should probably check for sickle cell, and that's the first time they tested. So I was fine until I was 8 years old. There are other people who will be challenged in terms of their health and other things right from birth. And so with that, they are able to diagnose and then find a solution. I mean, currently research suggests that up to 90% of births that are sickle cell disease births, those children will die before they are 5 years old. And so with that is, in this country, a lot of people, and there's been some conversation in the past about sickle cell deaths being attributed to malaria. They died from malaria, they died from malaria because there was no diagnosis of sickle cell disease. And so I can't say that there's a specific thing, but the most important thing is that you know when screening happens as soon as possible so that the right interventions can take place.
So it's quite important to know that you have sickle cell,
Yes.
the disease,
Yes,
and
I
I
do.
don't know if you also do.
I do. I have SC.
SC. Oh, okay. So this is a very important, point to note. And you could tell us about your struggles too, or what you've been through. So when you were diagnosed at 8 years old, how did your parents take it, and what did they do at that point?
From what I know, from what I've been told or what they care to tell me, I think there was some confusion. At the time, this would have been probably 25, 26 years ago, and they didn't know what we know now about sickle cell disease. So the little information that they had, they ran with it and said, we would do everything we can to support you and to shield you. I think the one thing that they remembered from the doctor's visits is that drink a lot of water, make sure she drinks a lot of water. So I became like a mobile poly tank, water reservoir, just if they could help it, I was drinking water. And so it affects everyone differently. There are some people I've spoken to who, when their parents found out, it was, right from the very beginning, just what intervention from birth can they put in place. And there are some people who also have found out and have felt helpless because they don't know where to turn, who to go to, people they can speak to answer their questions. So it's varied. And with sickle cell disease, in as much as you can say this group of people, they are SS, or this group of people, they are SC or beta thalassemia, every individual has a different manifestation of sickle cell. And so we try as much as possible through our work to create public awareness, and then you can then translate that information into, on a day-to-day basis, how you use that.
Do you have the same experience? When were you diagnosed? Was it from birth or later in, your childhood?
Yes, it was in infancy.
Okay.
I had one of the earliest symptoms of sickle cell disease. So it's called foot syndrome.
Okay.
So what happens is that you get swelling of the fingers and toes, and it's just because of the sickle cells blocking the vessels in there. And so my parents, of course, took me to the hospital, and they ran the sickle cell genotype test, and then that was when the diagnosis was made. And my mom is a health worker, and so from that point on, we started doing a lot of the interventions. So the drinking of water, the staying hydrated at every point, avoiding a million things, the taking of the medications and every single thing that, we are told at our reviews, just to ensure that I live as full a life as has been possible.
Yeah.
And so, yes, that's also my story. So it started very, very early for me.
And was it difficult for your family as well?
Yes, it comes with a lot of challenges because it's a chronic medical condition. So you live your normal life, but then it's interspersed with acute pain episodes and acute illnesses. So sometimes you'd have to be admitted. Sometimes somebody would have to leave work to come and stay by you.
Yeah.
And sometimes it's emotionally challenging. But then here I am. I mean, I'm a medical doctor. I'm running this organization. We are collaborating on this great projects and these great projects together. So, yes, it's both sides, right? But then in the end, I think that this experience is what has made me who I am today. So
I have a friend who also has been diagnosed with sickle cell. It's, I think, SS. One thing that his parents always say: "Hey, stop going out at night. Don't walk in the rain. Don't do all these things." Is it? I mean, a recurring concern for sickle cell. I mean, parents and also for children who've been diagnosed.
Yes. So there are certain defined things. We call it pathophysiology in medicine that would cause the crises or acute pain episodes or the various things that happen in sickle cell disease. But then we know that there are some physical things that may contribute to them, right? And so we call those things precipitants. So things like extremes of temperature, so when it's too cold or too warm, when you are dehydrated, when there's physical or emotional stress, when there's an infection, things like that are known to start certain physical processes in the body that would lead to the ailments, the bone pain, or the hemolysis, right, or all the other things that we see in sickle cell disease. So we advise persons living with sickle cell disease to look out for the specific things that precipitate these episodes in them, because as Nanesi mentioned, we all have a different experience with this condition. So you look out for those things and you try to avoid them so that you don't end up with a recurrent episode. So for some people, it's when it starts raining, you don't even have to be out in the rain, and then you have the episode. For some people, it's being in a cold room, and then for others, it's that very hot temperature, and sweating, not drinking water. So you see that when a child has sickle cell, we always encourage them to drink a lot of water, have your sweater, don't be out in the rain, don't run around as much as the other kids because you get exhausted, you'd sweat, you'd be dehydrated. So all these physical things that we are telling these kids or adults with sickle cell to do are just contributory factors, because we know that there are things that happen in the body, right? And so these physical things will just start the process of sickling, and so we want to prevent that process from starting. That's why we do these.
In terms of climate and also our region, is Ghana a very difficult place to live in as someone living with sickle cell?
I would say every climate has its challenges. Like Dr. Enam said, if you were somewhere where it's winter throughout the year, then that's an extreme. Naturally, the human body has a way of acclimatizing, does it not? And so there are some benefits to having one temperature throughout the year. But every climate has its challenges. Naturally, I would say for Ghana specifically, it's tropical, so it's very hot. And so that makes people who are living with sickle cell disease in Ghana prone to dehydration. So the remedy for that is make sure you are not dehydrated. And so that would mean just constantly drinking a lot of water, making sure that you're flushing toxins out of your system, you're flushing breakdowns out of your system, and you're healthy, you're well hydrated. You're well hydrated against the climate, yes.
So still on climate, but this time is the culture. So the culture of our people, culture in Ghana, how does that affect people living with sickle cell? Because I know a lot of people have a lot of misconceptions and a lot of prejudice and stigma all around, all over. So how do you deal with that? And what are some of the worst ones you've ever heard about?
Well, I think to answer your first question, the biggest thing would be the stigma associated with sickle cell disease. And it's owing to the fact that people are not well informed about sickle cell disease, right? And so if they don't know, they will just put in a narrative where they don't know. Unfortunately, it's been more of an ignorant narrative because in this country, you just don't know what this thing is and there isn't enough information to fill in the gaps. And so I would say the climate here just lends itself naturally to undue stigmatization, and therefore stakeholders, families, caregivers, and those with sickle cell themselves then feel the psychological effects of this disease in their lives. And so the big things that we do as advocacy groups is high up on our agenda to push anti-stigmatization campaigns and to create support systems for those who are dealing with these challenges so that they have someone to speak to.
So how many stigmatization, public stigma cases have you dealt with so far, with your organization?
Too many to count.
Oh, too many.
Too many.
I thought it was just the most recent one.
Oh, no,
We'll talk about that soon. However, I just want to see if there were previous ones that you were dealing with.
There have been.
What are the ones that you can remember, readily remember?
I wouldn't want to mention names, but then every time something happens, we get calls and messages. Have you seen this? What are you going to do about it? And sometimes we just go there and just observe what is happening. And in one instance, it was just really unfortunate to observe what was happening because it was called out and the person just kept going on and was not remorseful. And I had to think about it and wonder if it was a space I wanted to enter, because it was going to be very hurtful to go there and not even be able to reach out to the person and make any change. And so on a personal level, I decided, let me just let this go, because the person was being spoken to and there was absolutely no remorse. There was another one quite recently. Again, the messages kept coming. This person has done this. Don't you want to say something? And I was like, really, it keeps happening. And buttressing the points Nana is making, we've normalized the stigma around sickle cell disease in our setting such that so many people don't even recognize it. So you are saying something very derogatory about sickle cell, or you are doing something that stigmatizes somebody with sickle cell disease in your workplace or in your school, but then you don't even notice that what you are doing is stigmatizing. And even when it's called out to you, it doesn't even click. You don't make that connect because to you it's normal. Like, how dare they even complain, And it's really something that we need to be more, we need to think more about, because these are people like you, like anybody else that are living their lives, and it makes it very difficult, because if you listen to them, you listen to us, tell our stories, talk about the challenges that we are going through, and we are excelling despite all of these, and then we have people adding on to this, it makes it very, very difficult, and we keep on hearing these things and then having to quench the flames, because for us, we are leading a large number of people, and every time something else happens, we have to do damage control, basically. Yeah. So it's a challenge, but then we are still working on it, and then we put out the positive messages, we put out the information about the condition, we put out stories about people living with the condition and doing everything that everybody else is doing, so that that yes, you can have sickle cell disease and be anything and everything else, and it doesn't have to be a limitation or be a reason why you can't be whatever you want to be.
Yeah, we will not repeat any of the worst things people have said out of ignorance. However, what's the extent you've gone to get the right thing done with your organization?
Speaking to people as much as possible, because people say things or their utterances or their actions is usually as a result of their thinking. And so you want to deal with the roots, which is that you deal with their thinking, you deal with what they say and what they think. And so for me, anytime someone will lean towards stigmatization, it's just an opportunity for me to have a conversation with them or for the organization or volunteers or people to reach out and say, I think you're missing some information here. Let me help you fill in the gaps. And for us, that's the extent to which we go. We are constantly, last year, we ran a very successful campaign called I Am Not a Sickler. And that was a message we put out with some high-profile people, some medical people as well, saying, I'm not, this word that has been used to describe people with sickle cell, sickler, it's terrible.
It's derogatory.
So it is indeed. And we try, if you've ever used it or you know anyone who has ever used it, you have an opportunity to say, they are not sicklers, they are more than that. And you saw real faces of people say, I'm not a sickler, I'm a mother, I'm not a sickler, I'm a student, I'm not a sickler, I'm an entrepreneur. And seeing people's faces and them telling you, I don't want to be addressed by what you see as my limiting factor. And who coined that word sickler anyway? And what made you think it's okay to address me as such? I think those are the things that resonate with people, not, attacks and fighting back. And no, is that speaking to the consciousness of people and saying, if we can think about how this is registered in your psyche and we can update that thinking, hopefully we will update your utterances and your behavior as well.
This is quite an important information, and we'll get more from Dr. Bankas and also Esi right after this break. There's a lowdown. Don't go anywhere. Welcome back from the break. This is the lowdown on Ghanaweb TV. My name is Ismail Akwei, and we are discussing the effects of sickle cell and also all issues around sickle cell. Our guests are very important people. Our guest Esi from the Sickle Cell Awareness Initiative, and Dr. Enam Bankas, she's the managing director of Sickle Life. We're having very important discussions. We're telling us some of the stigma that's around sickle cell disease and how people tag derogatorily people who are living with sickle cell. Now, let's talk about some of the crises that people with sickle cell go through and what the public could do in terms of support in case they find them in crisis. And I know definitely parents know how to handle it because they go to the hospitals and they get information. So what are some of the crises? Let's start with you, Dr. Enam.
Okay, so this is a very important topic. First of all, sickle cell disease is not just pain or crisis. People just attribute sickle cell disease to the recurrent pain episode that people have, or what is termed crisis. But sickle cell disease is not just crisis. You have a full life. It's just a chronic medical condition interspersed with acute episodes of pain or other forms of crises. Right. So the first one are these acute pain episodes that people commonly know. And this is because of the sickle-shaped red blood cells, which are because of the mutated genes. And so what happens is that the red cells, they are usually donut-shaped, and they're able to go through your blood vessels easily, sending oxygen to every part of your body. But then when this mutation or change happens, now the red blood cells have this sickle shape and they get stuck in various vessels. And that is all that causes the pain because oxygen is not moving where it needs to go, and the waste products are not coming back. And so what we advise is that anytime you are having a pain episode, you need to go to the hospital. But then our patients know this, that once it starts, there are certain things you can do at home, right? So the first thing is to hydrate, drink a lot of water, because we've said that dehydration precipitates it and aggravates it. So you drink water so that your cells can flow, right? And then also you take your painkillers. Our patients, especially those who go for regular reviews, they usually have some mild analgesics at home. So you know that when your pain starts, there are certain painkillers that you can take at home that there are no problems with. So you take the mildest one, and then if it doesn't work after a while, you take the next one. And then if it's still not working, you need to rush to the hospital. There are some instances that if you have pain, and for example, there's an accompanying fever, you're having chest pain with your, like the pain is not just a limb or something, that one you don't wait for anything, you go immediately. If they are in a place where maybe there are other factors, for example, it's also cold in addition, you need to mitigate those other external factors. So you ensure that the temperature is regulated. So for the pain, you ensure that you do those things and then you take them to the hospital. In addition to that, other things may also happen in sickle cell disease. As I said, sickle cell is not just pain. We have something that we call hemolytic or hyper-hemolytic crisis. What that simply means is that they may be having dark urine or yellowing of their eyes and palms and other parts of the body. And this is also because of the very same thing, the sickle cells. So here, the cells are breaking down even much faster than normal. Back to the explanation, these abnormal red cells, because of the mutation or the genetic change, they are breaking down faster because the body knows that it needs oxygen, and these cells are not able to carry oxygen around the body. So they break down much faster, about 10 to 20 days, compared to the regular red cells that will break down in about 120 days. Now, if you get an additional factor, such as an infection, they'll start breaking down even faster than the faster rate of 10 to 20 days. And so a person with sickle cell who might already be a little jaundiced, that's having yellow eyes, will start having even more yellow eyes. And then their urine will become dark, right? Now, this is something that you need to show up in the hospital immediately, because what it means is that your red cells are breaking down, so you're going to become anemic, right? So that's something you need to show up at the hospital for, and that's because there's something that is causing it. So it could be an infection, so you need to show up. There's another thing we call a sequestration crisis. A sequestration crisis just means that the sickle cells, so everything is because of the sickle cell, right? It's pooling in an organ. It could be your liver or your spleen. So when that happens, and you would feel, that like the tummy may start getting larger, they may start having pain. So for the kids especially, the pediatricians teach them how to palpate or press their children's abdomen, so that if there's any change, they're able to detect it and rush them to the hospital. And then there's another one we call an aplastic crisis, where the blood level just drops drastically because of a certain infection, you understand? So these are all very, very different things that happen primarily because the person has sickle cell disease, because of a certain genetic change, right? But then they cause very different things in the body, right? So it's very important that we understand this. What can all of us do? As members of the public, if there's a child in your community who has sickle cell disease, there needs to be some level of understanding. Because, for example, if their blood level is low, so they are anemic, they obviously may not be as active as the average child. So if you maybe send them to do something, they may not be able to run at the same pace as another child. And even if they do that, they may probably be dyspneic, be like panting or something like that. So you need to be considerate of that child, you understand? In the classroom, we've said these children should be drinking a lot of water. If you are drinking a lot of water, you are going to be peeing a lot. So if you have a child with sickle cell in your class, you need to understand that this child is going to be going to the washroom a lot, right? And so teachers need to be more considerate and not see it as these children being stubborn or wanting to go out to play. It also means that we've said that stress could be a precipitant. So what it means is that around exam times, these children may be unwell. So there needs to be those kinds of concessions in schools such that if a child happens to be unwell during exams, it shouldn't be a reason not to allow them to write their exam. In certain schools, I worked in the university hospital, for example, you'd see people with sickle cell disease with their IV fluids on their arms writing their exam. That concession is made for them. Other than that, what keeps on happening, and it's so heartbreaking to see so many people with sickle cell disease held back in school over and over and over again, because preparing for exam is a stressor. So what it means is that every time you have an exam, you are going to be held back, you know. So this is like something that, and teachers are amongst us in the public. So it's something that we can all do. So when you think about it, you can do it. At a workplace, if you have a colleague who has sickle cell disease, the person needs to be going for reviews from time to time. And it's not just when they are sick, it's also when they are not sick, to prevent them from falling sick. So it means that you need to be considerate, you need to be understanding that they are not just leaving work because they don't want to work. They are leaving to prevent them from falling sick. So bosses and colleagues and everyone else needs to be understanding of this fact, that this person really needs to pace themselves in their work. If they say that, can you turn off the AC, it's not because they are being fussy or something of the sort. They are just trying to maintain their health. If they are being slower at something, it's just because they are pacing themselves. If they are going for reviews, it's because they are trying to maintain their health. So there are certain very basic things that people with sickle cell do, certain adjustments that they have to make in their lives to ensure that they are able to live like everyone else. But then without that understanding, you think that they are making life difficult for everyone. But then all of us have a role to play in doing this. Even for the media, it's very important that, like today, you've given us this platform to talk about this, and then we are making all of these things known to you, and so many other people are going to learn about these things. So you come to see that every single one of us has a role to play. The government has a role to play in terms of policy, every one of us. So it's very, very critical.
This is very, very important information. And I was just startled because there are a lot of things I also don't know, as you said. And I'm sure a lot of people are going to be educated, if I may say that. So, Nanesi, did you also go through some of these crises while in school? Were your teachers very accommodating of your situation?
I did go through some crises. Sometimes yes, sometimes no. You just never know what you are going to get, but that's human behavior, is it not? And so we just have to keep it moving. You do the best that you can, take each day at a time. Sometimes I've had the worst of it, you know, which needs the most advanced interventions. And then sometimes it's slight pain here or there where a simple painkiller will just knock it off, and then I can go about my business. But again, like Dr. Enam said, sickle cell is not just crisis, so my life is not engulfed with crisis. I am not bothered by crisis. It's when it comes as something that has to be dealt with, I deal with it and then I move forward. My biggest thing that I try to say to everyone is that try to think of yourself or your family member who's dealing with sickle cell, or your colleague or your classmates. Don't think of them as, don't be fire service. Don't think of them as a solution that you have to do when there's a fire, you put it out. It's more, how can we ensure that they are living a healthy life, they're living a happy life, they're living a fulfilled life. It's making sure that they are managing this condition well, and they are putting preventive measures in place as opposed to reactive measures in place. So it's not, oh, there's a crisis, we're at the hospital. We want to change that narrative around sickle cell. How can I take care of myself with these cost-effective, simple interventions that we've discussed to keep you well, to keep you healthy, to keep you out in the rain if you have to be, for lack of a better expression. But that's what I think our focus needs to be on.
Okay, so the Sickle Cell Awareness Initiative, when did you found that organization?
Formally in 2018, we started working from 2015, but we weren't formally out in the media. We launched 3 years later. We had to do a lot of research, speak to a lot of people. We were entering a very interesting space and in a climate that is also very particular. And so we launched finally in 2018, and we've been doing some good work since.
So what have you been doing?
Wow, okay. Besides the advocacy work that we do, just making sure that we will take as many of these interviews as possible, speak to people directly, speak to as many of the stakeholders that we can, from the individuals to families to caretakers to the government. Besides that, we make sure that we conduct blood donation drives, screening exercises. So we've spoken a lot about genotype. You don't know if you're a carrier to make a decision that's informed if you don't know your genotype, right? So screening people for free, encouraging them, school outreaches, all these campaigns like I spoke to you about, I'm Not a Sickler. We've also embarked on an infrastructural project. So we built an outpatient department at the Kolebu Teaching Hospital so that we know there's a space for people with enhanced facilities, that they can visit. And so it's been a broad spectrum of things that we do on a day-to-day basis.
So you built an entire outpatient department?
Yes, we did.
Oh, then
yes, we did.
From funding from,
individuals,
okay.
Organizations. We had a lot of people come together and say, I want to support. Some supported in kind with cement and tiles and air conditioners. Other people gave money, companies gave money. And so we look forward to going back to the Ghana Institute of Clinical Genetics, and that was just phase 1 of our project. So we look forward to going back and doing phase 2 and beyond.
That's quite interesting. Okay. And Sickle Life, you are the managing director. What have you been doing, and when did you start the organization?
Yes, so formally we were incorporated in 2016, but then prior to that, in 2013, I started it as just a blog. So what had happened was that I was diagnosed with a complication of the condition called Vascular Necrosis. So at the time, I just had to put my life on hold a bit because I couldn't do much. I couldn't walk, I couldn't play basketball, I couldn't jog, I couldn't do anything. So I just started writing about what was happening to me. And I realized that there was a gap in the knowledge about sickle cell disease. So I just blogging. And then there was a lot of interest from Ghana, South Africa, US, UK, even health workers, medical students. I was like, okay, let's just keep writing. And then I finished school in 2015. And then
medical school?
Medical school.
Okay.
So I was like, okay, let's see what we can do with this. So 2016, we launched officially. And then we had our first screening project and blood donation. And then I saw that, oh, wow, a lot of my colleagues and like even my senior colleagues came around, and then they were like, yes, let's do this together because there's really this gap within the system in terms of screening and advocacy and so much more for sickle cell disease. And so since then, in collaboration with organizations like Sky, we've been able to run so many free sickle cell disease screening projects because, again, it's important that we empower people to make informed decisions about sickle cell disease. And once you are not providing the screening for them, they are not able to do that. So we do the screening, we do the genetic counseling, and then we do the health education through these health talks. We also do a lot of online engagement through our social media activities, and then in-person interviews such as this. And then we have a very strong support group system where we are able to engage persons living with sickle cell disease. And then they get to know that, one, you're not the only person who is going through all of this. You're able to learn from other people, like how to manage some of the challenges that you are going through. And then we have a welfare system such that if you are having a particular challenge with the condition and you need some support, we're able to finance some of it. We also have something we call the mentorship project, where we have young people who have sickle cell disease, and we bring them in contact with adults who have the condition. And then it's just for mentorship, because there are these one of the myths out there, as you mentioned, is that it's a death sentence. So we're able to show these young people and their parents that this is us. We have sickle cell disease. We are past 18 or whatever age that we were given or people give, and we are still here, right? And so it's a mentorship project that is really good for these young people. And then, so these are things that we've been doing since 2016, and these young people get to see that this is something that is possible. So these are just a number of the things that we've been doing. And so far, I think that we are doing a lot together. So yes.
Soon, I'll let you give your contacts out so people could reach out to you and be a part of your organization if they need to. But what kind of interventions or support are you getting from, let's say, the state? Is there anything like that from the state? Any support?
Okay, so well, there's a lot that can be done. I think that for one, this year or the past 2 years, we've seen some improvements or at least movements in the sickle cell disease space. So Nanisi mentioned hydroxyurea. It's a disease-modifying medication that people with sickle cell disease are given. And there's been work towards putting it on NHIS. And this was a promise that we received over 2 years ago. And there's been progress, very gradual progress towards putting it on NHIS so that so many more children and adults living with sickle cell disease can have access to it, because that's been the biggest limitation. And so I guess the support we are getting from the states is that it's finally been put on NHIS. However, the rollout has been the challenge. And so we are hoping that finally it can be rolled out so that we can have our kids on it. But then apart from that, this has been the first time in a very long time that we are seeing some movements in the sickle cell disease space in Ghana. But then there could be more, because, for example, we don't have a formal sickle cell disease program in the country as we have for like malaria program or tuberculosis or HIV or others. And so what happens is that the running of the condition in the country is being done on NGO level. So every NGO is doing what they can in their own small way, tackling a particular aspect of the condition. But then if we had a control program on that national level, then we'll consolidate everything, and then it will be, you know, the planning will be centralized, and then we can break it all down. So that's something that would be great if it could come from the state. But other than that, there are also like several levels to this. So on the healthcare system level as well, there are some great initiatives that have started. So Nanesi mentioned newborn screening, which would be a very great initiative if it could be rolled out on the national level. We've had pilot projects for several years, but then we've not been able to nationalize it because it's also being run by a single NGO or foundation. And so if the states like took it up, it would also be a way to diagnose all the kids in sickle cell disease who have, in Ghana, who have sickle cell disease, and then start them on hydroxyurea, for example. You know, so that's something that we should look at. And then providing comprehensive sickle cell care, you know, because as it is now, there are very few facilities like the Ghana Institute of Clinical Genetics where we can say that they are experts in managing sickle cell disease. So what happens currently is that there are people who will fall sick on a Friday afternoon and wait till Monday for the clinic to be opened to go there because they don't want to go anywhere else because they are the experts at managing sickle cell, which is quite unfortunate because anything could happen. So we need to get to that point where on the healthcare systems level, we have more facilities offering comprehensive sickle cell care. We have more training institutions, having more hematologists for one, training our other health professionals in sickle cell disease, you know, having more research in the condition. So there are a lot, there's a lot. I mean, I could write a whole list of, like a whole wish list of things that I want for sickle cell disease. And so, yeah.
I know there have been a lot of studies that are done internationally
Yes.
on sickle cell, and I hear about cures and all of that. Is there a cure now?
So, for one, there are some studies being done in Ghana. Let me give a shout out to my department. So I work at Kolebu, and my department, we are doing a lot of great studies in sickle cell disease. I just wish that we could be doing more and on a national level. But yes, there is a cure for sickle cell disease. However, it's not an accessible and widespread cure yet. So it's a bone marrow transplant. And what fundamentally is done is that, as we said, this is a genetic disease. And so the process is basically to give the person medication that wipes out the person's existing bone marrow, and then you transplant the bone marrow of a donor who does not have sickle cell disease. But then it's a very cumbersome process because you need to get somebody who matches them. It's called an HLA match, where it's like a more advanced form of like the way you do your blood group, where you need to match, because if you don't match, you could get a very bad reaction, but like exponentially increased, right? Yes, so you do somebody, like you find somebody who matches but doesn't have sickle cell disease, and then you transplant their marrow into that person, and then now that person who had sickle cell disease, the marrow, that new marrow grows in them, and now they no longer have sickle cell disease because whatever grows now is of what was donated. However, this is not easily, like it's not accessible, it's not available.
Are they still on trial stage? Or
it's being rolled out. There's another one which is called gene therapy, which is still in the trial phase.
Is that in Ghana now? Is Kolebu
no,
doing
not
that?
at all. Not at all.
Has Kolebu brought out something already, or you are still studying?
Oh, for gene therapy? Oh no, not we are not. No.
So I'm talking about Kolebu, and if the studies they are doing has done any.
No, Kolebu is not doing studies in gene therapy. We are doing studies in disease-modifying medications for sickle cell disease, and I'm very optimistic about them.
So no solutions out yet from the study?
No, we are still in the process.
You're still in the process.
Yes.
So how did you take the news when you heard that, oh, there's a cure? And I'm sure the first time you hear about it, maybe, I don't know, what did you feel about that?
Well, I think essentially for those who have some knowledge of sickle cell, for a long time it's been a rolling line that there's no cure for sickle cell disease, because you think of bone marrow transplant and you think it's not accessible, it's very expensive, it's very risky. So the benefit has to be, 100% and zero risk, which is almost never the case, correct? So it's not even something that is widely publicized as there's a cure for sickle cell. For a long time, there was talk that there's no cure for sickle cell. Now, the medical space has seen a lot of improvement. We are hopeful that there will be a cure for sickle cell in our lifetime, because gene therapy, hydroxyurea, other management, there's a lot of work being done around the clock to ensure that there is a cure. But for now, management is your best route, and so that's what we push for.
So for the about 99% or 99.5% of people who can't access the bone therapy, is it bone therapy?
Bone marrow
the bone marrow transplant, and also the other cures that have come up, what advice would you give them? And also, what advice would you give the general public, finally?
I think everything we've said so far. And yes, just take care of yourself. Visit your local physician and let them point you in the right direction in terms of seeking a hematologist, a care center, someone to take care of you. A lot of questions that we have on a day-to-day basis is that, I'm managing this at home, what medication should I take? Please don't manage it at home.
So how can they reach out to Sickle Cell Awareness Initiative?
We're online, so all our information is online. Once you put a search in Google, you can find us. We're on all the socials as Sky Ghana. So Sky is SCAI for Sickle Cell Awareness Initiative, Sky Ghana. You can find us. All our information is online. So
is there a special thing they'll get when they join?
Support is very special. Very special.
And then Sickle Life, how can they reach you?
Okay. So we're also online. So you'd find us on Facebook, Sickle Life. And then Twitter, Instagram, Sickle_Life. Then LinkedIn, Sickle Life.
Okay. You also provide support.
Yes, we do.
And no throw pillow, something like no. Thank you very
Not
much,
yet.
Dr. Enam Sefakor Bankas, Managing Director of Sickle Life, and also Esi Duker-McMartey, founder of Sickle Cell Awareness Initiative. Thank you very much for coming to the Lowdown.
Thank you.
You've just watched an exciting episode of the Lowdown, and we brought you all the information you need about sickle cell disease. Watch us every Monday on Ghanaweb TV and all of our digital channels. This is the Lowdown. My name is Ismail Akwei. Be safe.